Fears for the future of the UK economy grow. Many cities and towns remain deserted, despite the government's plea for people to get back to work.
Now, the actress and Loose Women panellist Denise Welch believes that this is the result of scaremongering by many in the media and government, and she joins us today alongside our very own Dr Sara to explain more on all of this. Denise, why have you got talking about this? Why do you feel you want to articulate this? Because you know, as you do, this is only your opinion. This is not the facts and figures being given to us by the government, or the interpretation, which I think you've got the main problem with by the media. Why are you putting your head above the parapets on this?
Well, to be honest, Eamonn, I disagree with you there, if I may, because everything I do put out is actually based on the government's facts and figures. And I have taken a lot of criticism for this, but I've never felt so passionate about anything in my life. As you know, and Ruth knows very well, that I have been very outspoken as a mental health advocate for 31 years. So everything that I do publicly or on Twitter of this nature is trying to find a parity between how we deal with physical illness and how we deal with mental illness on the same level. And I have been shocked and appalled by the way the government and indeed our media have represented this virus to people. We now have the collateral damage where depression, clinical depression, that's major depressive disorder, has doubled in this country as a result of it. Anorexia is nearly doubled in young people because they feel like they're out of control of their lives. And basically for 5 months now, we have had a rolling death count every day. We've never had one for the 500 that die of cancer every day. We've never had one for 180 people who die of heart disease every day, or 20 plus at the moment who are dying of suicide every day. Now, of course we haven't, but if we did, we'd all have been locked up because we couldn't be able to deal with it. But funnily enough, as things have improved drastically over the few months, I noticed that I didn't see the other day when the news starts, bong, nobody dies in the UK because of a corona-related illness. No, what we have is, bong, fears rise as spikes reach 1,075 positive tests a day. So if you're going to frighten us with how many were dying every day, please enlighten us and tell us how things have improved, that when no one is dying. Because as a mental health person, and if people want to say she's on about that again, I don't care, because of the people that it does help, is that I will do anything to help balance the fear-mongering. The other day, it said universities could become the care homes of the second wave. How dare they? And then it cuts to a clip of two presenters sitting going, it's terrifying, isn't it, to think that they're saying now that universities might become the care home. Just as these young people on the threshold of their life are going back to university. It's absolutely disgraceful.
But Denise, I think there will be people watching this who are vulnerable, people who have family members who are vulnerable, who've been shielding, and they will say it is those very young people that you're talking about who are going and not social distancing, not wearing their masks. They don't suffer too badly from COVID, but taking it back home. That's,
Ruth, I'm not saying about the social distancing. I'm not, the thing is, because if you talk about this, which is the truth. So the other day, if I put something out, which is everything I do, I have researched. I can't tell you how important this is to me. And another thing I'd like to point out, Ruth and Eamonn and Sara, is that I asked ITV if they would like to sign an NDA today so that I can show them the amount of NHS doctors, nurses, dentists who are coming to me, a T-list celebrity, according to megastar Piers Morgan, about I'm basically telling the truth. So I was saying the other day, 2,800 people were on ventilators where coronavirus was involved at the peak. The other day, 52 were. To me, that is good news as how we have moved forward. I'm not saying this is over. I am not saying how horrendous this virus is and was. But at the moment, we have a 1 in 2 million chance of dying of COVID, and I have a 1 in 3 chance of getting cancer. So please, can the government
just tell us what do you want? Yeah, what do you want the government to do? You're clearly very passionate about it, obviously very angry about it. What do you want them to do? Because they will say that they are listening to the advice from health professionals, won't they? And they are going on that. They're going on numbers, advice, looking at other European countries where there are spikes. What do you want them to do?
Yeah, there are spikes, Ruth, can I just say, at the moment, and I'm talking about at the moment, not when the flu season starts, I'm talking about at the moment, these spikes are positive tests. At the moment, they are not leading to increased hospitalizations and deaths. Also, a very, very, very high up doctor who came to me via direct message on Twitter was telling me about the failures within this testing system and how it is picking up old coronaviruses that may have been someone that was positive 6 weeks ago that's not infectious. So if we have a government that can snap their fingers and put us into lockdown, have the decency to explain why and to explain the testing. Have the decency as to why so many people were put down as a COVID death when they hadn't even been tested. Have the decency to explain why if you tested positive for COVID-19, within 6 weeks, if you die in a car accident, you're put down as a COVID death. My mum died a horrendous death from cancer 8 years ago. When she died, she had pneumonia. She didn't die of pneumonia, she died of cancer. So all I'm saying is, answer the questions. I'm not saying what to do. I've been told many times, you're not an immunologist. Of course I'm not. But I'm also not putting anything out that I'm not hearing from NHS doctors and nurses who cannot speak out.
OK, well, let's see if we can provide any of these answers to you with our Dr Sara. You've listened to a very impassionate Denise there. She says she's not a conspiracy theorist. She's not an anti-vaxxer. She's not extremely right-wing on all of this. She just says...
Extremely right-wing. I'm not remotely right-wing, Eamonn.
OK, I'm only using your quote back at you, right? So just calm down, right? And we'll try and get the doctor to see if she can give you some answers to this. Right, doctor?
I think there's always going to be bias in the media. So you'll always have a statistic saying, you know, one paper will say the cases are on the rise, there is a spike. The exact same figures will be taken by another media outlet, which will say, we're improving our testing and we're therefore able to track and trace and isolate better. I think for me, it's really important that we look at the death rates, we look at the number of hospitalizations, the number of people on ventilators, and those are on the decrease despite the spikes in number of cases, which usually indicates that actually we are managing to actually track and trace and isolate as well as we'd like. But I do also think that there is so much to this virus we don't know still. Yes, it's been around, you know, since December, and we're getting more knowledge, but we don't know how our immune system is going to work in terms of our antibodies, whether we will be immune to it, for how long we're going to be immune to it. And we also don't know how it's going to affect us come the winter and when the flu season and other winter viruses come around. So I do think we still need to be cautious, but there are positives that we are learning from this. And I can see why Denise is upset in terms of mental health, because it's taking a huge toll on mental health. And, you know, I've seen it even in clinics and I've seen how my patients are suffering with it. But I think we do still need to be cautious. We do still need to practice social distancing, wearing masks, washing hands.
See, Denise, this is all quite complicated because this is a time of national emergency. And as I know from myself at the start of all of this, you're not allowed to question the narrative on such things. So there are restrictions on publications, there are restrictions on broadcasters, and there will be a lot of people saying that you are simply rabble-rousing, you're creating panic with all of this.
How am I creating panic, Eamonn? I'm giving the data, which the other day I said, Doncaster Hospital celebrates 8 weeks without a COVID case. Someone put, oh, I'm sick of this, you're disgusting. Is that not great? Do you know why? Because when the flu season comes, the NHS is overwhelmed every single year, particularly in years like 2017, 2018, when 30,000 people died, excess deaths related to flu and cold conditions. We never heard about that because none of us knew this rolling count thing. It happens every year. But the fact is that before the flu season happens and before people are allowed to put things down as COVID death when maybe they haven't been tested, all I want to say to people is, 5 months ago, the wonderful doctors and nurses in the NHS, nobody knew about this is what they're telling me. Nobody knew about it. But now we have dexamethasone, we have hydrocortisone, we have remdesivir, we have proning the patients instead of putting them on ventilators. All I'm saying is that we don't need to go back, hopefully, to where we were 5 months ago.
Yes.
That's surely good news. That is not me rabble-rousing.
What you're saying to people who are maybe watching this at home today and are not in work, you're saying, let's stop all this lockdown business and get back to work. That's what you're saying, isn't it?
Well, I'm not telling anybody what to do. I'm trying to allay the fears of people who think that if they go outside and touch somebody, they're going to die of coronavirus. There is more chance of us walking outside and being hit by a bus at the moment than dying of this virus at the moment. And so why, therefore, are we still prioritizing this virus over everything else? The cancers are 500 a day. They always are. Heart disease. My GP friend told me in tears that she has had middle-aged men presenting on the phone, going through a heart attack because they will not go to their local hospital because we have frightened people into thinking that they're death zones. The local hospital she refers to has zero COVID and has had for weeks.
Let's hear what the doctor says.
Sorry, we had a man on the show last week whose cancer is now terminal because he couldn't get his treatment. And do you think that the people are too frightened to come out? The message needs to change. It's like, yes, we have to be careful, but we've got to stop being so frightened and be able to come out of our homes, go back to work, go back to hospitals, get your treatment.
Oh, it's imperative that if you are not well, if you're getting any new symptoms, you need to discuss it with your GP. Unfortunately, with this coronavirus pandemic, we know that there were going to be the people that died from coronavirus, but there was also going to be the indirect deaths, those that died because they weren't able to get to hospital appointments, too scared to go to hospital appointments, and then also the long-term deaths, those that die as a result of, not being able to get the education, the finance, all the other things that are needed to survive long term. And I think it's so important that, please, if you have symptoms, you must speak to your GP.
Okay,
and at
guys.
the moment, of course,
yes.
At the moment, people aren't going in, people aren't putting their sick relatives into hospital because they won't be able to see them, and it's criminal.
Okay.
If the hospital is sorry, anyway. I know I'm passionate about this.
But you're not alone, Denise.
You're allowed to be passionate, Denise.
We're looking at other celebrities here. John Bishop saying no one is suggesting COVID-19 is not a significant problem, but to change the way we all live, the damage that is doing to our young people, which is a point that Denise was talking about mental health. Lord Alan Sugar says basically get your can't say that next bit, back in there now to work. Same with local councils, big business isn't helping, we need people back to work. And the football commentator Jeff Stelling says, I am just frustrated by the nanny state wanting to make sure I will live forever, or at least what feels like forever. Now, do celebrities, do people in the public eye like Denise speaking out help you, hinder you, give you confidence, reassure you, speak for you or not? Let us know throughout the programme. Dr Sara, Denise, thank you both very much indeed.
Yes, thank you. And Denise, we talked about mental health, and you are an amazing advocate for raising mental health issues. And Denise's book about her own depression, The Unwelcome Visitor, is out now and doing extremely well, and has certainly opened a conversation. Denise, thank you.